So I had several areas of comment. First, I just so appreciate, Stephanie, you and the leadership that you've provided over the several years process to this. And I just want to remind people that it had a very long process with 2 public comment periods and 3,400 comments, of which, if you haven't sat through the Instructional Quality Commission, every comment goes through line by line, and the Instructional Quality Commission decides which ones they're going to accept and incorporate, which I think was over 300, and which ones with the rationale and if they didn't think they needed it or not. Secondly, the standards came from 2008, and in the 10 or 11 years since then, we've had a lot of legislative processes that required things needed to be included in addition to what standards we already had. So I think the committee worked really hard to incorporate legal requirements, from the Healthy Youth Act, but there were other ones, I am assuming. And I don't know if that's something you want to kind of summarize. I have a couple other comments, but I think it's important to know that we had to put some things in by legislators. There was a whole hearing process that went through the legislator. They then get sent to us to incorporate. So could you do that first, and then I'll go back to a couple.
Sure. So I'll just kind of list off the themes within the education code that we're required to include: inclusion and equity, organ procurement and tissue donation, nutrition education, sexual harassment and violence, lifelong health, aging and financial literacy, of course, the California Healthy Youth Act. Sexual harassment and violence was also to be considered, and then sexual abuse and sex trafficking prevention education, sexual abuse and sexual assault awareness and prevention education, and healthy relationships and mental health instruction.
Thank you. So my understanding is this is an update, and that 94 was the last health framework. Is that right?
I believe so.
So that's a long time.
And
things have changed, and there are new requirements, and just as we know, we took us almost 20 years to update our science framework, and we know a lot more about science, that we provide this as a resource to local districts. So my next question is, I understand working out in local districts that local county offices and also I believe CDE are providing guidance to educators now in the field, talking points, resources. So I'm interested in you sharing what you're aware of or what the funding provides. So what resources can school districts expect to have as they do the work going forward? Again, I just think it's important to clarify that people are out there, they're getting some talking points. So are you aware, or are you in the process of providing that?
So we are, and we actually have Doreen here from the Orange County Department of Education that can speak to that.
I think that'd be helpful.
I'll let her tell you about all of the work that the Health Collaboration Committee is doing with that money.
I would have worn a nicer jacket and not just a cardigan if I knew I was going to be coming up here. But we are really, really excited for the rollout and implementation project of this framework. We already have a Health Collaboration Committee. It's a statewide committee that has representation from many agencies, statewide agencies, but also our County Office of Education. We have the 2018 National Health Education Teacher of the Year. So we have master health education teachers that are part of that. Higher ed, of course, all our CDE content experts. Let's see, we have representation from the State Board of Education, and we also have PTAs on there. So it's a really, really diverse, great group of folks who are guiding the process. And we are working on 3 distinct pieces. One is definitely support for administrators. So we're looking at online professional learning modules. So we want to make them easy to access and to meet the needs, the diverse needs of our administrators based on where they're at with supporting health education. They're going to be available online, and they could also be available for in-person professional learning and professional development. In addition to that, we are going to, of course, have some professional learning programs for educators. And our goal is to do that at the regional, at different regional levels, so we could build the capacity of our counties. So we're going to bring county offices of education together at regional communities of practice, build their capacity so we have ongoing support even past this project. So it's not just about a project that just ends and everything goes away. We really want our counties to feel empowered that they can continue supporting health education. We're going to build their capacity, give them everything that they need, resources that we're building together as the statewide committee, county offices of education come back and they provide local trainings for their districts and their schools so that they could help support, again, building also a networking community. Can districts talk to each other? Oh, how did you do your parent review nights? Oh, that's a great idea. We could adopt that. What do you do for your professional learning? Can counties, maybe smaller counties, come together and co-train their districts and teachers and provide that ongoing support? Then the last piece is we're going to build a website that we're going to house everything on, house all of the resources, the online professional learning modules for the administrators, as well all of the training materials and the resources that we're providing for teachers. And really, the goal here is we're building in an evaluation process. Our goal is to glean information from the field. We want to get information from our county offices. We want to get information from our districts, and most importantly, from our teachers, so that we could continue to improve this process, continue to meet the needs, because ultimately our main focus is student outcomes, and we really want to make sure that we're impacting our students in the best way we can around their health, knowing that that's going to make them college, career, and life ready. And that's the quick summary.
Thank you. Thank you. So my last comment to both of you is I think it's really important that the public know that this is a resource that we provide for that we do for our content areas as a part of the statewide process, but it's a resource, and that now it translates to action at the local level, which I believe the county offices provide support to local districts, but I think it's important to clarify what processes local districts must and will go through to actually translate this to professional development, to training, to guidance, to materials, to course guidelines, opt-out. What happens now? Because this is a resource that we have spent a long time through a process, which I'm sure we're going to continue to talk about, but what happens now is the process going forward to districts for the parents who have children who came and spoke and want to know what's going to happen to their children in the classroom. Could you translate that, Stephanie? And is that possible to think about just sort of what happens next?
So with the work of Doreen and Orange County Department and all of the health educators within this collaboration committee, as she said, we're building the capacity of the county offices to provide that local support for our school districts. So in being a resource for them for any questions that they have around the California Healthy Youth Act, around instructional materials, around the content of the framework, to provide the professional learning that they need. But it's really up to the local school districts in how they implement all of this. And so they do have to provide the comprehensive sex education in 7th or in middle school and in high school. That's not a choice, but how they do it is their decision. And so our job is just to provide them the resources and the support and able to do that in a high quality way.
Can I just add a quick piece? Really, the county offices are doing that with our districts, and I could speak, of course, for what we do in Orange County Department of Ed, but of course, also across the state. I have colleagues that we talk all the time, and we are providing those services. We'll come out to districts and consult and really support that process, make sure that they have a really good understanding. Here are some tools for how to communicate parent opt-out. Transparency with parents is so important. Parents feel so much better when they've had an opportunity to dialogue with administrators and even teachers. Teachers have been doing a great job of explaining, no, that's not what we're teaching. We're actually teaching this. You have the right to come and view all of the curricula that we're sharing with your students. So we're definitely doing that. And I want you to know that our intention is to also build that into the rollout and implementation project, ensure that we are providing that support. There is so much happening also around family health education. A lot of our districts and schools provide a ton of services on family-based health education. They do parent nights all the time for, around, especially around like nutrition and how to be an active family, how to protect your kids, what you need to know as a parent around human trafficking. That stuff is happening. So we're really hoping that definitely guidance for educators, but because the framework also has that great family and community partnership piece, we really want to highlight that and engage families as partners in supporting the health of their children. So we'll definitely be intentional about that. Thank you.